We are the Imperial Valley's AM 1230 Kxo El Centro, California. And with us on the telephone today, well, it's Imperial County Chairman of the Board of Supervisors, Luis Plancarte, Imperial County Chief Executive Officer, Tony Rojotas, and, if I'm not mistaken, Deputy Director, Imperial County Environmental Health Services, Jeff Lamoure.
Good morning. Good morning. That is correct. And Tony had to step away for an unexpected phone call, so you got Jeff and me.
You mean the governor called with a pardon?
I don't know what Tony might have done. Maybe that's what happened.
It could be. Okay. Gentlemen, we've been talking the last several weeks, it seems like forever, about the COVID-19 pandemic, and specifically how is affecting Imperial County. Now, I understand, Imperial County, part of California, though Sacramento may not actually know where we are. You can't get any further away from Sacramento geographically than Imperial County. We're following the mandates coming out of Sacramento and the information that's coming out of Washington. Luis, are we seeing any movement in the state, in the county, as far as progress in moving forward on getting back to whatever is normal?
Well, Carol, I'm glad you asked. We've really been seeking to work a little bit different with the state, primarily in the way that we're looking for local flexibility to open up Imperial County to the areas that can safely be opened up. We are very concerned about the governor setting a set of rules or regulations by which counties are able to reopen, but the fact that he's painting everything with the same brush is not the same. And obviously we feel here in Imperial County we don't have the population density that, say, a San Diego or Orange County or other counties would have. We live much more extended. And so that provides us some opportunities to modify a bit the guidelines that he has set forth for opening the county. We know that some counties in Northern California that are way Northern California, very low population, they have been able to set some lower requirements that have allowed them to go to phase 2, the higher end. But our concern is that our workers and our business owners, they're struggling to make ends meet. We really need to get things going. And then there's some things that, like the requirement of no more than one death in 14 days. Things like that are attainable. So yesterday, the cities in Imperial County drafted a letter which went to the governor expressing those concerns and asking him to reevaluate some of those guidelines that he has put across the board.
Well, one of the mandates is contact tracing, and part of what I read in that, and as you are well aware, it's not all very clear, but anywhere from 30 to 60 people are needed to do contact tracing in Imperial County. That's one of the requirements. Also, testing, the level of testing. Now, as Dr. Monday has been very careful to explain, okay, we've got the drive-through testing at the fairgrounds. They can do about 130 tests per day. The county lab, public health department lab, can do more, but they couldn't get the reagents necessary for the testing from their suppliers, so they were down for a while. But the numbers are skewed because basically the only people getting tested are people that fit in a narrow area of criteria for testing in the valley. Are we making any progress there?
I'll let Jeff take that one.
We are making. Good morning, Carroll. This is Jeff Lamoure. We are making progress. Let's go back to your earlier comment with regards to contact tracing. You've indicated that we need, in your estimates, between 30 to 60 contact tracers for Imperial County. And actually, following the governor's the criteria for each county to follow, the contact tracing the requirement for that is at least 15 contact tracers per 100,000 residents. So that would put us in the neighborhood of about 27.5 or 28 contact tracers. We currently have 15 on staff now that are currently handling the load. In the event of an additional surge, then we will need that additional 17 to meet that requirement for that criteria. So we are currently working on that and securing the additional tracers for that. So that we're moving along quite well there, and we'll meet that criteria. As far as the testing, we have the requirement for that is that, again, the criteria is that we hit a minimum testing of 1.5 tests per 1,000 residents. So it's roughly we're looking at about 280 or so tests per day. With OptumServe, we're right now at 132. One lane is 132 tests a day. With that, then we have our hospitals that are doing their testing. As you already pointed out, the public health lab is receiving specimens for testing, but also we have a number of our providers that are also testing. So we believe that we are right there in line with meeting that criteria, and we're continuing to expand. We've just received an allotment of specimens, about 500 specimen collection kits, and those will be distributed out to, again, add to enhanced testing that we're doing countywide.
Okay, are the numbers of tests that are being performed at the hospitals and at private physician offices and clinics, are they included in the numbers the county is publishing as patients tested?
The tests that are included are those that are the PCR, the confirmatory testing. Those are what we see at OptumServe, that type of testing. Yes, those are what are included in our testing numbers.
But not the testing that is done at the hospitals or at clinics and healthcare providers.
Again, the clinic, they are. My understanding is that they are doing the PCR analysis. So yes, they are. The PCR analysis is what's being counted.
Okay.
Carroll, there's two types of testing generally being done out there right now. That's the PCR and the antibody. The antibody is currently not being reported because that requires a confirmation test via PCR. So the PCR, whether people are the doctors are referring people to Quest, or LabCorp, or it's being done at the hospitals, clinics, or through the county, those are reported.
Okay.
And just to add on that, there is one test, the Abbott test, that is being shared between the two hospitals, and that is an FDA and EAU approved method, and so it's specific for COVID analysis for antibodies. So that specific antibody test, that's the only one that's currently being included.
Well, as CBS News mentioned just a short time ago, that particular test is under question because of a high number of false negatives. So,
aware of that as well. But currently, we're following the standards of the state, and the state is recognizing that at this point in time. If that does change in the future, then we will have to reevaluate that. But again, this is a very fluid event that we're working on and trying to move forward with. And as the information becomes more clear, and some of the changes that are having to be made at the federal and the state and local levels, we adjust as necessary.
Well, and again, as I told Chairman Plancarte, I understand that directions are coming from Washington, directions are coming from Sacramento. They're oftentimes conflicting and oftentimes very unclear. So as you said, it is fluid. Chairman Plancarte, are we moving forward?
Well, we do continue to move forward. Of the 12 or 14 requirements or guidelines that the governor put forth for opening the county, I believe that at least half or more we are there. Perhaps 1/3 of them we are substantially there. It's just a a matter of getting the information to prove to the governor that we are there. There are two that we obviously are having difficulty with, and that is the substance of our letter that we ink with the cities. And that primarily relates to the cases reported within a 14-day period and the death. Other than that, our teams are working very, very hard. Public health, behavioral health, social services. We all continue to move forward and provide the services that the community needs while we are trying to forge that road towards opening our business in our communities.
Okay, looking at the May revise that Governor Newsom issued yesterday, he put out that there is a very real possibility of a 10% cut in pay for state employees and furloughs. Has the county looked at that?
Well, the county right now is looking at everything that potentially might come our way in the future. We have to critically look at everything that we are doing and how we are doing it. We also have to look at where the funding is coming from and what the likelihood is that funding will be affected in any way. So right now we're, doing a lot of brainstorming, a lot of whiteboard, to consider some of the things that may be affected. We are also putting a lot of effort into listening what the associations are saying. So everything from the state tax collectors to the associations that represent just about every department for every service that we provide, and really hoping that they can help us figure out early enough so that we can make those corrections, but not so late that it affects our workforce, our employees, and our community.
Okay, and based on that, shifting away a bit from the COVID-19, the May revise did include funds for the New River and also for the Salton Sea. Make you smile?
Well, it does definitely give us some hope. We know we have some projects to work with. IID, the city of Calexico and the county of Imperial have that MOU to work on the New River. I really hope that we can see that to fruition sooner versus later. It's coming. I just hope that, he doesn't get worried about pocket change and kind of diverse that money. Otherwise, yes, I am very, very happy that it's there, and I look forward to, beginning to move some projects forward with that.
Well, the cynical me is looking at, okay, I believe it was Prop 68 that had the money that would go to the Salton Sea mitigation. That might get redirected. The gas tax money might get redirected again. You might see, I know what it said when voters approved it, but we need the money over here. Have you gotten any sense of that out of Sacramento?
Nothing yet, but I think, at this time with the scale of COVID and it being something that we have not seen before, I still think that everything will be on the table. We'll just have to be very attentive and continue to state our efforts of where we want it to go and hope for the best. Really do the best that we can with whatever monies will be available. I don't expect things to go away forever. Some things may be deferred, but I am confident that in one way or another we will get them back.
Well, I always figure if they take about $50 billion away from the bullet train, it might help the rest of the state.
Well, that's one place to start.
Okay. Did we miss anything?
No, just one thing I'd like to add. I know there's been some misinformation out there with regards to the counts, the numbers for our testing sites. And just to clarify on that, the numbers that go into making up our positive cases are solely those that are the residents that reside in Imperial County. If at our testing sites, if we have an individual that is tested, let's say is out of Yuma, Arizona, or out of San Diego, or Riverside for that matter, or Mexicali, Part of our contact tracing and part of that investigation at FEPs, they follow up with an individual to confirm their primary residence. And their primary residence is in another location. If it's not in Imperial County, again, we're providing them with information, but ultimately the isolation notice that's crafted is then given to that jurisdiction so that at that point they can implement it. And that number also goes with that individual to that jurisdiction. So whether it be back to Mexico, back to San Diego County, Riverside County, into Arizona, that goes with that individual. So does not go towards our total positive count. So just to clarify that.
Well, that was one of the questions. Kxo has probably 10 or 12 postal service places where, okay, you've got a street address in Imperial County in Kxo, and you live in Mexicali, and that's being traced through.
Understood, and that's one of the challenges that we are faced with, and that's one of the main components of contact tracing is to obviously they want to obviously look at the individual who tested positive been in contact with, but also to confirm their primary place of residence amongst a number of other questions that they're asking. So that's a critical component to ensure that depending on where they reside, primarily reside, that jurisdiction is aware of that they are positive and also taking the appropriate noticing for that individual. Okay.
We appreciate the visit this morning, Jeff Lamoure and Luis Plancarte. And at some point in the not-too-distant future, I would hope that we will be able to do this sitting in the same room and, sharing a cup of coffee while we do it.
I look forward to it.
Looking forward to it.
Okay. Gentlemen, thank you very much, and, enjoy the rest of the day.
Enjoy your weekend. Thank you.
Hey, what's up, man? What's going on? Hey, let me call you back, man.
Hey man, how's it going?
Hi, so I have this stain and I heard you're the guy.
Say no more. Valley Dry Cleaning's got you covered. There you go, man.
Cool, man. Hey, man, you got it out. What'd you guys do?
Let's just say we've got a secret weapon.
Thanks, man.